As the ambient pressure decreases, the air in your middle ears and eustachian tubes expands, exerting outward pressure on the tubes and your eardrums. Normally, expanding air in your middle ears can escape down your eustachian tubes. But if your tubes are blocked with mucus, barotrauma can result. This can happen if you dive while you have cold symptoms, or if you rely on decongestants that may wear off during your dive. This problem is known as reverse block or reverse squeeze and may affect your sinuses or your middle ears. If this occurs, you'll first feel pressure, then pain. Some divers may also experience vertigo. You may be able to relieve painful middle ear pressure by pointing the affected ear toward the surface. In such a case, you should make a proper ascent, keeping in mind that the last 30 feet or 9 meters will be the most difficult. If you experience reverse block, you must stop your ascent. Usually, within a short amount of time and with some yawning and swallowing, your middle ear space will equalize. If it doesn't, you may need to descend a few feet or about a meter until the discomfort resolves. Do not attempt to equalize as you would on descent, as this will only worsen the situation. If a pressure differential affects your sinuses, more severe problems can occur. If you have allergy symptoms or swollen mucosa in your nose and sinuses, you may be able to press some air into your sinuses during descent. But, on ascent, the flap of swollen mucosa may completely obstruct the opening to your sinuses and prevent any air from leaving. Equalization maneuvers cannot relieve sharp pain in your head or face. The only possible solution in such a case is to descend and turn your head in different positions. This may relieve the pressure and free the air passage to your sinus cavity. If this doesn't help, you will have to surface and use a nasal decongestant to enable equalization. Another kind of ascent-related symptom is alternobaric vertigo, which is caused by unequal pressure in your ears due to difficulty with one of your eustachian tubes. As you ascend, and the air in your middle ears expands, if the pressure in one ear changes faster than in the other, the resulting imbalance can cause vertigo, as well as nausea and spatial disorientation. Any kind of vertigo can be serious when experienced underwater. The main problem with these symptoms, particularly spatial disorientation, is that they can lead divers to panic. You should descend a little to minimize the pressure imbalance and wait for the symptoms to resolve. The important thing is to stay calm. And just as with reverse block, never try to equalize using a blowing maneuver while you're experiencing alternobaric vertigo. Of course, preventing barotrauma before it occurs is the best strategy. Although equalization during ascent is usually a passive process, equalization during descent is always an active process, meaning you have to pay attention to performing an appropriate procedure. All methods for equalizing your ears are simply ways of opening up the eustachian tubes so air can enter.